Hi, my name is Michelle Lee, and this is my interview video for St. David's School of Nursing. So, to answer the first question, when I was 8 years old, my dad had abdominal surgery and complications that left my mom and I terrified and fully anxious. I vividly remember my mom crying because of feeling frustrated and helpless and confused when we were receiving the medical updates, as well as having the post operative care explained to us because of a language barrier. So at the time, my parents didn't understand English fully, and the healthcare team didn't speak fluent Vietnamese. So I remember being 8 years old, translating as best as I could to figure out how to help my mom take care of my dad. And with a combination of feeling anxiety and terrified and seeing my mom struggle and having her feel helpless because she couldn't understand because of the language barrier, this essentially motivated me to improve my Vietnamese language acquisition as well as learning medical terminology in both languages. As a nurse, I would love to use this skill to provide communication, clear communication, empathy, and reassurance to vulnerable families in their moments of uncertainty. To answer the second question, I chose Texas State's nursing school because of the reputation the program has for having highly knowledgeable nurses based on the high NCLEX first-time pass rates in recent years, as well as having confidently skilled nurses because of the on-site trainings that nurses receive at their clinicals, as well as the time they spend in the lab simulations on campus in Round Rock. When I had the opportunity to tour St. David's with my peers from the Pre-Nursing LLC, I had the opportunity to speak with the faculty, staff, and current students. And from there, I concluded that not only are the staff dedicated to the healthcare field, but they're also dedicated to the success of their students. To prepare for the program, I obtained my CCMA license and shadowed nurses in different specialties, exposing me to different walks of life, culturally, religiously, nationally, and socially, economically, and also allowing me to get a acclimation to the fast-paced environment of a hospital setting, as well as thinking critically during those times. In addition to taking the prerequisites, I took the initiative to take medical terminology as well as pathopharmacology to expand my clinical language and to familiarize myself and get started on learning the content I would learn during the first semester in the pathophysiology and pharmacology for nurses course. Answering question number 3, over the summer I was a barista at a boba shop, which eventually became a high stress level environment after Hurricane Beryl. Nonetheless, I had the opportunity of practicing the abilities to stay calm, prioritizing, and leading a team during peak hours. Eventually, we were faced with high demands for product output and disorganization. However, with this, I took the initiative to restructure our workflow, assign tasks based on strengths, and streamline production for efficiency. I believe the ability to assess a chaotic situation and delegate tasks and adapt quickly mirrors the fast-paced nature of healthcare that is crucial, as well as teamwork and decision-making. In addition to being a barista, I am a lab anatomy and physiology instructor, and with this, I get to strengthen and deepen my understanding for the subject while practicing the crucial skill of explaining complex concepts. In addition, I answer student questions that often require critical thinking and problem-solving skills. With the experiences combined, I feel like it has prepared me for the rigorous program of nursing school and has allowed me to practice my leadership, adaptive, and communication skills that would ultimately lead me to be a successful nurse. Answering question number 4, my first priority would be remaining calm and ensuring safety, not only for me, but also the other drivers on the road. I would do this by pressing the hazard lights and start moving my way to the side of the road. From there, I would assess the situation in the area that I'm in and call roadside assistance or a tow truck. Once that has been taken care of, my priority then would be to notify my professor of my situation in hopes of discussing alternative options for my exams, such as taking it at a later date. Once that has been handled, I would call a friend, possibly a student who isn't in my class, so I wouldn't be taking time away from them, or taking a public transportation or ride share to campus to continue on with my day. Question number 5. I recognize that nursing school will require full dedication and intense commitment in time, myself, my education, and my career. But I believe that my experiences and my abilities together will help me be successful in the 5-semester program of St. David's. In previous semesters, I balanced being a full-time student, holding a job, being in extracurriculars, as well as teaching multiple anatomy lab sections. And I've done this by maintaining a very detailed planner that has a monthly, weekly, and daily layout. In this planner, I would keep track of assignments, exam dates, lab meetings, extracurricular meetings like my work shifts. In addition to all those things, I would also utilize a time blocking method to make sure that I'm dedicating my time to studying, practicing slide lectures, or just doing things that have high priority. In addition to that, I also get assignments done early so I don't fall behind. I believe that remaining proactive, disciplined, and adaptive will lead me to be successful in nursing school and successful in the career field. I plan to take a similar approach when I enter nursing school by setting clear priorities, practicing stress and time management techniques, and maintaining self-discipline. Maintaining and taking care of your health is also essential, whether that be mental, physical, and emotional. And I plan to do this by taking time and time blocking it to exercise or just relaxing to avoid burnout. I believe that even though it's much easier said than done, I've been having these tactics and I've been utilizing them since high school and brought them over to college here at Texas State. And my success is a direct result and a reflection of my dedication here.